Hello students, good morning. Today we shall learn about aortic valve disease. Now what is aortic valve disease? Aortic valve disease is the disease that is seen in the valves of the aorta, and this valve is located between the main pumping chamber, that is the left ventricle, and the artery, that is the aorta, which carries or supplies blood to the rest of the body. And this can be congenital or it may be due to various other causes. So the main diseases that occurs in this valve will be aortic valve stenosis, which means narrowing or obstruction in the valves, or it could also be aortic valve regurgitation, which can be like either the valves are floppy, are saggy, or it is not opening and closing effectively, and it is like weak, the valves are weak. So what happens is this actually hampers the blood that is flowing in from the left ventricle, which is the main chamber, and which is supplied into the aorta, and the aorta, which is the main artery which is supplying the blood to the rest of the body. Now this narrowing, what happens is, as I mentioned, there can be stenosis, which means there can be narrowing or thickening of the valves of the aorta, and this can also cause some kind of an obstruction in the actual blood flow that is flowing out from the left ventricle into the aorta. And similarly, when the valves are weak, the blood flow is not being controlled, and eventually what happens, there will be backward flow of blood. So this is similar to what you have seen when we study the mitral valve stenosis and regurgitation, but it's almost the same, on the same lines, but here, except that we are dealing with the aortic valve. Now this picture clearly shows you, the first picture here is talking about a healthy valve, the aortic valve, and you can see how well it is located, and also when it is supposed to be closed, how the flaps are being closed, and it is open, how it is meant to be open. But whereas in a diseased valve, you can still see there is an opening. Okay, so even though the valves are meant to be closed, there is still some kind of an opening, and it is through this little opening the blood tends to be flowing backward as well. Another picture which is showing you very clearly about what a normal aortic valve looks like when it is open, when it is closed, and what a stenotic valve looks like. So that means when there is stenosis or narrowing or obstruction or hardening of the valves, and what it tends to do is it is not in a position to close or rather open properly, and how it looks like when it is open and how it still looks like when it is closed. So this is a stenosis. So that means there is a thorough narrowing, and this is going to be obstructing the actual amount of blood that is supposed to be flowing out from the left ventricle into the. Now what are the etiological causes for this condition? It could be congenital, there could be excess of calcium buildup on the valve, and it also could be the rheumatic fever. The risk factors will include the age, that is old age, and as you age, again all these conditions may occur. That means calcification of the valves, the hardening of the valves, and also it could be some other kind of congenital heart disease. It could also be due to various infections that can affect the heart, and even if with people with comorbidities, so that tends to be or poses like the risk factors, and that will include like diabetes, high cholesterol levels, also high blood pressure levels. Also in patients who's got chronic kidney disease and history of radiation therapy to the chest. Okay, for some reason where there is repeated exposure to radiation, this can also cause hardening of valves. Now the pathophysiology, so what exactly goes on with this condition? So due to these etiological factors, the valves tend to get hardened and eventually causing obstruction in the blood flow. So what happens is the blood flow which is supposed to be happening from the left ventricle into the aorta is minimized. Okay, and what happens there's going to be excess logging of blood in the left ventricle, which causes eventually the left ventricular systolic pressure increases, the left ventricle enlarges, and that is nothing but the left ventricular hypertrophy, and as due to this, again the left ventricular muscle itself gets weakened and finally starts to dysfunction. Okay? And due to this, what is going to happen, there is decrease in the aortic pressure, and due to this lack of blood supply to the rest of the body, eventually what is going to happen, even the heart muscle is not able to receive this adequate amount of blood. This will result in a condition called as myocardial ischemia, because there is going to be lack of oxygen and blood supply to the heart muscle as well. eventually what's going to happen, this is going to end up with left ventricular failure. So this is what exactly goes on with this aortic stenosis. Now, what are the clinical manifestations, or rather what are the signs and symptoms that are exhibited by the patient with this condition? It includes abnormal heart sounds, as I just explained to you in the previous heart disease condition. That is nothing but the heart murmur. So when you listen to the chest of the patient using a stethoscope, you will see, or you will hear a turbulence in the blood flow. So that is nothing but the gushing noise of the blood again. So that's going to be there, or that's going to be heard very clearly, and that is nothing but the heart murmur. Patients may also complain of chest pain or angina. Patients tend to feel weak or dizzy, shortness of breath, and severe fatigue. So, and this usually what happens is when they are performing increased activity or some kind of excess physical activity is being performed, then their fatigue tends to be increasing. Heart palpitations, again fluttering heartbeat is also going to be noticed. Patient's nutritional status is also going to be diminished. Patients will not be showing that appetite. Also losing weight, again that's going to be associated with that. And some of the common signs of heart failure, when as we told you, when we saw it in the pathophysiology, that eventually this is going to be ending up in left ventricular failure. So what are the typical signs and symptoms of heart failure? It includes fatigue, shortness of breath, and swollen ankles and feet. And all this is due to the stenotic valve, which is not allowing the blood to flow through. That's going to put excess pressure, and there's going to be volume overload in that particular chamber, leading to hypertrophy, increase in pressure, and eventually causing dysfunction and failure of the chamber or the left ventricle. The complications associated with aortic valve stenosis will include heart failure, stroke, and blood clots, which I explained again. Due to this excess logging or clogging of blood in the particular chamber, and the blood is actually being retained in that chamber for a long period, because the reason why is the valve is not allowing blood to flow through effectively. So eventually what's going to happen, the blood clots appear, okay, heart rhythm abnormalities, and also complications may be infections to the heart such as endocarditis, and the final complication will be death. The diagnosis for this particular disorder will include thorough physical examination, history collection, and also certain investigations and diagnostic measures, which includes echocardiogram, electrocardiogram, chest x-ray, exercise stress test, CT scan, which is nothing but cardiac computerized tomography scan, cardiac MRI scan, and to get a more detailed picture about what is going on with the valves can only be diagnosed or seen when we do the cardiac catheterization. So the patient is being sent to the cath lab, and when we assess the heart functioning, rather the valves using contrast, and that actually clearly shows us how narrowed the valves. Now, how do we manage this condition? So basically the valve is not functioning effectively, so means it needs a repair, or rather it has to be replaced. So if the stenosis is not that hard, rather, as I told you, the valves can be calcified, so that means it tends to be very, very hard. So if in some case, again, if it is not a calcified valve, then again the management can be done with using balloon valvuloplasty. So again, you see that there is a catheter with a balloon there, and then you just position that balloon in that exact position of the valve. You inflate the balloon, leave it there for a few seconds, you deflate it, and then you check on the blood flow, and if it is restored, then it's fine. And again, once you do that, the blood flow is restored in the patient's heart and to the rest of the. This kind of procedure is usually done in the cath lab, and this is becoming a very common procedure, like having patients with aortic valve stenosis being managed, or the treatment being provided in the cath lab as a intervention gap, which means or still some space, and that is a cause for the blood to backflow. So in such situations, then a prosthesis helps. So you put this the artificial or the mechanical valve in position, and this can be taken care of. Now the next condition is aortic regurgitation. So what happens here? So that means even when the valve closes, it is not, the flaps are not sitting together. So that means there is still a gap, and that causes blood to flow back and forth, again back into the left ventricle, and then some again goes back into the aorta, and this is going to happen for a very, very long time. And what happens here again in this picture, you can see it very clearly. This is supposed to be a closed valve, but you can see that it still looks like it remains open. Okay, so that is a condition of aortic regurgitation. And put a lot of pressure on the left ventricle. So some of the etiological causes, or rather the causes for this particular condition, will include congenital valve disease, age-related changes in the heart, which is the calcium deficits, infections of the heart, that is endocarditis, occasions of rheumatic fever, or many episodes of rheumatic fever, again affecting the heart. And the other disease like the Marfan syndrome, which is nothing but a connective tissue disease, and this can also affect the heart, and also due to certain cases of trauma. Okay, so this can also cause this particular regurgitation in the valve. Clinical manifestations will include fatigue, weakness, shortness of breath, swollen ankles and feet, chest pain, lightheadedness, irregular pulse, which is arrhythmia, heart murmur, and also fluttering heartbeat, or nothing but palpitation. Risk factors and complications. Risk factors are nothing but age and heart conditions, again at birth, so nothing but congenital heart disease. Certain conditions that can affect, such as Marfan syndrome, nothing but the connective tissue disorder. And other aortic valve other heart valve conditions can also be a cause for this aortic valve disease, also high blood pressure conditions. Complications associated will include heart failure, infections of the heart such as endocarditis, heart rhythm abnormalities, which means the patient can have palpitations, and eventually the most deadly complication can be death. The medical management for this condition, again, it's most important that you keep your blood pressure under check. So the patient is going to be on beta blockers, ACE inhibitors, and also which is going to keep a check on the blood pressure, and that is going to eventually help in the the flowing of blood effectively. Diuretics, as we mentioned, because of there can be fluid overload, and in order to avoid edematous conditions, the patient is going to be on diuretics. Anti-anginals, which is going to be preventing the chest pain, and nitrates, which is very, very important, like nitroglycerin or otherwise called as glyceryl trinitrate, GTN in short, and calcium antagonists, which will include that diltiazem or nifedipine. Verapamil is another calcium antagonist, and beta blockers, atenolol, propranolol, and metoprolol. All this is going to keep your blood pressure under check. So medications are going to be administered to the patient, and this is very, very crucial and important for the patient to maintain it, because that is going to be helping the heart, again trying to help it function effectively. The surgical management will include aortic valve repair and aortic valve replacement. So that is what we saw even in the previous case. So aortic valve replacement will include the biological valves, or rather the mechanical valve replacement, prosthesis. Now, how do we manage these patients on a nursing management basis? So which will include the patient is being prepared to be sent to the cath lab for having a balloon valvuloplasty. So you need to have your pre-checks done, make sure the investigations are being sent for and the reports have been received. Check your patient's how thin your blood is, and there's no kind of clotting happening, and a complete blood profile, echocardiogram report, CT scan if needed, a complete 12-lead ECG. And very important also, if the patient is again, make sure you monitor the patient's vital signs, and make sure if he's diabetic, record the blood sugars, and also the serum creatinine, very, very important. You need to have that also reported and recorded, and make sure the investigations are being sent for and the reports are being collected. Monitor the patient's heart, assess for the heart sounds, and also explain this procedure to the patient and the family, and make sure you receive the informed consent, so that the patient and the family signs it, and they're ready for the management to be the healthcare team to proceed with the particular management aspect. Similarly, for the surgical valvuloplasty measures, which includes either repair or replacement, again, this is going to be a surgical procedure, so obviously done in the operation theatre, which will include the anesthesia to be introduced or administered, so that the patient and the family needs to be talking to the anaesthetist, and also the surgeon who's going to be doing the procedure. And very important to assess the patient's cardiovascular conditions and functioning, and report every aspect of it, even with the allergies of the patient. And similarly, you'll have to get an informed consent signed by the patient and the family, and only after the team has explained to the family and the patient regarding the pros of the procedure and how it's going to be benefiting the patient once he has the valvuloplasty done, or once he's had the surgical valve repair or replacement done. Now, what is a nursing diagnosis in a patient like this? So, you obviously know that since there is no enough output, so there is no amount of blood that is flowing from the left ventricle into the aorta to the rest of the body for circulation. So, even in stenotic condition and also regurgitation condition, there is no adequate output happening. So, definitely there is decreased cardiac output resulting in the valve insufficiency. And due to this, you know, the clinical signs and symptoms will include fatigue, weakness, excessive tiredness, and this again finally ends up in activity intolerance. Okay. Hypothermia can occur because, as we told, the causes can be due to other valve conditions or other conditions related to the heart, like rheumatic fever and infections in the heart like endocarditis. So, if that not treated appropriately can end up in hypothermia like fever conditions, so need to be on antibiotics. So, hypothermia is also related to infection, can be one of the diagnoses. Again, risk for ineffective tissue perfusion. So, we know the risks associated with the condition. So, the risks also becomes one of the most important nursing diagnosis part. And it also includes nutritional imbalance, nutritional status, because we know that the patient will be having a loss of appetite. Also, a decrease in the body weight. So, again, due to a lack of appetite, so that nutritional imbalance also becomes, or rather imbalance in nutritional status also becomes a nursing diagnosis. And the last but not the least, you can add two more diagnoses, which can be anxiety associated with a particular diseased condition, and last but not the least will be deficient knowledge regarding the particular diseased condition. And for the need to do is the patient is, or rather the nurse and the healthcare team is going to be talking to the patient and the family, and they're going to be explaining and giving counseling and education. And this was going to be on a lot of aspects, which includes anticoagulation therapy, prevention of the infections, rather endocarditis. Also, very importantly, you're going to be talking to the patient about his diet, because as I told you, if the patient has already got some comorbidities like high blood pressure, then very important you have a strict DASH diet, again, which is nothing but you're going to be making sure that you have a low salt diet as well, and make sure you as much as possible have a balanced diet. And obviously the physical activity is going to be a problem, because again the heart is not pumping sufficiently, the body is not receiving adequate amount of blood and oxygen to the tissues, so weakness and fatigue is going to be an issue. So rather educate the patient on, you know, not to get overly strained or exerted, or rather go into exertion, because this is going to put a lot of pressure on the heart. So take it as it comes, you know, mild physical activity. And very importantly, telling him about the, since he's having this prosthesis or this foreign body sitting there, like the biological valve or the mechanical valve, very importantly, you tell him about the importance of anticoagulants and the duration for taking the medications, and also when he needs to come back for a follow-up, which is very, very crucial. And on follow-up, and when he comes back for the checkups, very importantly, you check on the blood, how thin it is. So you do INR on the patient. You're going to check on how thin the blood is. Very important that you maintain the viscosity of the blood. It has to be thin and not like clogging or getting clotted, and making sure he's having his blood pressure medications on time. And if he's on any kind of antibiotics for a reason, like especially because of the infections, and continued for the said or the prescribed amount of period, and then maybe he can come off it once the doctors are happy for him to come off the medications. But otherwise, hypertensive, antihypertensives, anticoagulants are very, very important and crucial, and this has to be understood by the patient and the family, along with a good diet, reducing stress. And if he's an obese, if he's a patient who's big, then again that has to be also be taken care of. So all this, and then when he comes back for follow-ups, again he's going to be getting an echocardiogram done. Again, we're going to be assessing the valve functioning, and that will actually help us know whether the valve is still in place, functioning effectively, and there is adequate amount of blood that is flowing through and in and through the valves. So this is the health education. And some of the preventive measures, as I mentioned to you, is the whole idea is to prevent infections, or especially when the patient is exposed and ends up with a strep throat, especially in childhood times, like the children are exposed and they end up having this rheumatic fever. And this as you go and repeated occasions, and as they grow by, this can have an impact on the heart as well, and that is how you end up developing the rheumatic heart disease. And any other risk factors for the coronary artery disease has to be taken under control. So childhood obesity, and you know, the amount of junk food that the children eat. So all that has to be taken care of right from the start. And in patients with comorbidities, make sure their blood pressure, obesity and high cholesterol levels are under check. Keeping your weight under control, blood pressure, cholesterol levels, managing stress, avoiding tobacco, alcohol, smoking, making sure you take care of your gums and teeth. Again, this can also be the oral hygiene. So why we talk about this is we do not want any kind of infections from your oral cavity to be transported to the rest of the body, and this can also have an impact on the heart. So, and educating the family the importance of follow-up. So these are all the ways that we can educate and counsel the patient and the family, just so that they can lead a and physically fit. Thank you for your time, and we shall discuss the next condition in my next session. Thank you.